For my general impression, first I would get the patient's name, age, sex, weight, and this will help me do a few things. I can determine whether the patient is sick or not sick, and it'll also help me find out their level of consciousness, because if they are able to talk to me, I know they are alert, and most likely alert and oriented to a person, place, time, and events. But if they're not able to speak to me, I would determine their level of consciousness by the acronym AVPU. That stands for alert, verbal stimulation, painful stimulation, or they are completely unresponsive. And I would go through each one. If they're not if they're not noticeably alert, I would try and stimulate them by talking to them. And if that doesn't work, pinch their nail bed to see if I get any kind of response on painful stimulation. And if neither of those work, they're going to be considered completely unresponsive. Then, if they are able to speak to me, I would get their chief complaint and why they were calling for our help today. And while I'm doing all this, I'll continually assess them for any major life threats to their airway, breathing, or circulation. And that brings us to the ABCs, the airway, breathing, and circulation. I'd be able to check the airway and breathing at the same time. I can do this by looking, listening, and feeling. I can look at the quality of the airway, see if their trachea is deviated at all. Breathing, I can check and see. Looking, quality of the airway, and see if there's an equal chest rise and fall. Then I can listen to their lungs and their airway, make sure I don't hear any stridor, wheezing, rails, crackles, and also listen to how they speak. If they're speaking in 2 or 3 word sentences, or if they can carry on a proper conversation. Then I can finally I can feel the quality of their breath and airway to be sure that they're getting a proper ventilation done by listening to all quadrants and lobes of their lungs. Then if either of these two, airway and breathing, are compromised in any way, take the proper steps to control and secure the airway, and then promptly transport to an emergency room. The third part of the ABCs is the patient's circulation. First thing I'd check would be for life threats, obviously, no major bleeding anywhere. And if there happens to be some, go ahead and promptly control and stop any major bleeding or hemorrhaging. And I can also assess the patient's skin tone, their skin, and their pulses at the same time. I can reach down to feel their skin, and while I'm doing that, I can feel their pulse, see if it's a bounding pulse, if it's very thready, weak, or if it's within normal limits. I can also feel the temperature and turgor, and if they're diaphoretic or clammy on their skin while I'm checking their pulse as well. And this way I can see if they're cool, clammy, diaphoretic, warm, feverish, etc. Say, after all the major life threats are controlled at the moment, and I continuously keep an eye out for any arising life threats, I can continue on and assess the patient's pupils, make sure they're equal and reactive to light. This way I can know if they possibly have any type of brain injury or strokes and things of that nature. Then I can start in towards my secondary assessment by exposing the body where needed to examine the patient's chief complaint. And finally, while doing this, I can make my transport decision, whether it needs to be an emergent transport to an ER, or if I can quote unquote stay in play and take things a little slower. It doesn't need to be as emergent as if they had some sort of major life threat still going on.